Everyone, Jason Warrelmann here. I'm the healthcare leader at UiPath, and we're at HIMSS. I'm excited about this session today because it's the one that every healthcare executive should hear. And by way of introduction, I'd like to introduce Amit Bhagat, leader of Amitech. Maybe real quick as we get started, Amit, maybe tell the audience a little bit about Amitech and your vision and what you're trying to achieve.
Great question, Jason. I mean, we are really a healthcare first company and started with data and analytics. And over the years, we have really realized that the value of automation that UiPath brings to the table, combining that with data, with insights and analytics, and making it operational. So that is what we've been able to do with taking the insights from data and making it operational in the business of healthcare. And that's how we're able to create so much more value for our customers. So I'm excited to kind of share our story and what we've been able to do with payers and providers with you here.
One of the key things of why I'm excited about this conversation is the way automation has really matured. And we've been saying for a long time that it's really gone from automation 0.5 to really 1.0. Some industries are 2.0 to 3.0. Healthcare is still behind. Welcome to healthcare. We're at HIMSS. It proves the point. But when we look at, especially through the pandemic, we look at health systems, before where automation was a cool new shiny object that they really heard about, automation really took its ramp up during the pandemic. Not enough people coming in, need to keep level of commitment services to the patient. How do I do all this administrative work without letting the backlog occur? And a lot of them wanted to adopt automation. They came to us for help. They came to you to help, and our whole ecosystem of partners. But there's one thing that we found during that time, is that they want automation. They want automation across their enterprise, but they're having a hard time even getting clinicians in the door, keeping nurses, keeping clinical staff. How are they supposed to build an automation platform? How are they supposed to maintain an automation platform? How do they actually make sure it's best practice? Many of them were forced to adopt a telehealth program. We all know that's a commonplace in the health system. They'd rather spend that than on automation, even though the automation can completely pay for the telehealth platform, right? So what we saw last year, a lot of organizations said, you know what? Not now. I'm going to wait. I'm going to take a big hole, but I'm going to wait a year. Or they found a service, and there's a lot of service companies out there that will automate as a service where you give them your data, you give them access to your platform, and they'll automate for you at a bit of a gain share. But we saw a lot of issues with that, where now they're coming to us a year later and saying, I don't like this model, it's too much of a risk for me. But I believe you got around that, didn't you, Amit, with your customer Mercy? Maybe you could tell a little bit about that journey you went on with them and this unique program that you're driving.
Yeah, I mean, that's a great point. And I think the biggest difference with Mercy was when pandemic hit, obviously most hospital systems were stressed. Revenue shortfall, we always thought that healthcare is recession proof, but that was not the case. I mean, most hospital systems run at a very low margin anyways. So this created a burning platform, but obviously they had so many battles to fight, right? And one of the things that we were able to do with Mercy that was unique and different, that their leaders at the top realized that this new shiny object automation has potential. It can really help them reduce cost. And so it was a top-down approach at the highest level, thinking about, hey, how can we bring automation to our company, but not only just dabble, but really take that with a long-term plan and be part of their strategy. And so we were able to bring the expertise, some of the critical success factors that most people don't think about. They think about automation as a technology implementation, but really, it's very hard to transform anything without thinking about change management, thinking about workforce transformation, right? When you bring bots into your environment, when you bring digital worker in your environment, how are you gonna take advantage of the free capacity that you're creating, the new capacity, right? The freeing up capacity. So what we were able to do with this is to really think about a program with change management, with governance, with center of excellence. Really thinking about, hey, this needs to be a centralized, enterprise-wide initiative. And those were the three key differentiation that I thought was really stood out for us. And we partnered with them and worked with the leadership very closely to really take this a program approach and a roadmap, if you will. And we built out a product called an approach, a strategy called Flint Blueprint, which allows our customers to really create quick wins, but self-funded roadmap with thinking about where are the opportunities within my system with automation, what are the first ones to take on, the second and third, and so on and so forth, understanding what their capacity is and how much time we need from them. So really minimizing that, because we, as a company, know the business of healthcare really well. We are able to bring that expertise and say, hey, customer, hey, system, here is what you need to start looking. Revenue cycle is the number one candidate. But yeah, there are a lot of other areas, HR, for example, and talent management, all the back office function, right? So looking at that, and Mercy, really, we started with our first automation was remittance posting, to really applying looking at the bank records and really posting into their EHR. A very simple automation that's very repetitive and manual. But then that was the first one which saved them $3 million.
138,000 hours, if I remember
Oh,
correctly.
yeah, it's a lot of, but the big difference was, hey, are we willing to think about workforce transformation? What can we do with this new digital labor that we have brought in that is freeing us human labor, right? How can we redeploy, take cost out? What are the things we should be doing? That conversation we were able to have with them.
And that's amazing. And I think that's why the story is so profound, is we see this all the time. And I have a lot of partners and I have a lot of customers that try to do this direct. And some are really successful, so don't get me wrong. But what's really the key to success here? It's having the vision. It's being able to detail and know a roadmap and have the experience to build the automations. I have a lot of consultants that don't know how to develop robots but try. And I have a lot of developers that know how to develop robots but really don't know healthcare. And that's what's special here. Because when you came into Mercy, you said, listen, I know you're stretched. You have a vision. That vision is a quantitative goal. Cost out, improve patient experience, and also create an innovative product in the market. They didn't know what that product was yet, right? You took that vision and said, I know the top 20 use cases, my team's experience. I also have this domain experts. I will be your augmented center of excellence. And we're going to churn this out and give you a full blueprint over 3 years. I think it was a 3-year blueprint, where we already know what we're going to build and we know how much you're going to save over the next 3 years before you've even built it.
Yeah, and I think it was a collaboration. They brought a lot of ideas,
and they have
into
to be.
this, into this. And what was interesting was that, yes, we started with a goal in mind, and they have been amazing, successful. They've already saved in orders of over $20 million in first year, right? And we started with 20 bots, I believe, was the first implementation. We are over 100 bots, and that is a story that's really, to me, is amazing in the sense that, hey, you adopt a new technology, a new shiny object, but you bring it into your business environment in a way that's really helping you achieve your business goals.
That's right.
Right? And along the way, you are hitting some major cost savings, right? When you think about healthcare, I mean, it's just how much of admin expense we have. I mean, $3.8 trillion we spend in healthcare. This is like 2018 data, right? I mean, it's even more like, so out of that, almost $1 trillion goes into admin expense. And of course, our healthcare is very complex. I mean, we got multi-payer system, and it's just a complex system. But 25% of that admin cost is basically, in my view, is waste. And so this is the opportunity with automation to really hit on those opportunities where we can take some of those workload that humans are doing and use bots to really free up that capacity.
Yeah, I couldn't agree with you more. And I think it's also interesting, it wasn't just what we call unattended, which is the server-side automation. You also deployed attended automation and a number of innovative use cases. I saw the one around sepsis management that you did at the clinical side. And of course, I've seen the cache application. You used EOB extraction, some EDI solution, which UiPath has as well. So that's what's great also is, while Mercy was coming up the scale, you were already experienced UiPath developers and knew how to bake out these solutions. And that really is key, right?
Absolutely.
It's like any other developer. If you have a developer that's made that widget 100 times, you're going to accelerate that widget development by 45 to 50%. And that's what you've essentially brought, right?
Yeah.
The other piece, which I think is interesting and why I say every executive needs to hear this, aside from get where you need to go fast, which right now is what everyone needs. We're sitting second half, we're at HIMSS, it's late in the buying season, and every executive's coming to us and saying, I need automation and I need to prove an outcome by the end of the year. What can you do? Right? You've built that model and you've built products with UiPath around that model, and you call it Flint. But what's unique here, and this is where it differentiates and why I wanted to bring you on this session today, is there are services that do this today. There are service companies out there that will completely manage your automation and sell it as a service. Say, I'm going to improve your cost to collect by 2%. Give me access to your system. It's a fully automated system. Don't worry about the bots. You get an outcome, right? And I'm willing to take risk, which you take risk on your program too. So it's a very similar outcome. But here's the key. The service companies, the intellectual property is theirs. What was unique about Mercy, they said to you, I want to create a new product that I can make a revenue stream off of.
Yeah.
Maybe you could talk a little bit about that, because I think it's a very unique aspect and an ask I'm starting to hear from my executives.
Yeah, absolutely. I mean, this relationship which started with just bringing automation in the door and proving the concept out, right, to a program. And beyond that, the success we got was so interesting together was that, hey, Mercy felt like, man, we're building all these assets, and this could be easily redeployed in other systems, right? When you think about a lot of these UiPath components we're building with Mercy and solving some of their automation challenges are very similar challenges that other systems have. And what we realized, like 70 to 80% of these assets can be reused. And one of the things that Mercy said was like, hey, we can together, let's take our partnership to the next level. Maybe we can take these assets and sell it back to other systems and do a revenue share. And that was a unique opportunity for us, and we entered into a revenue share model with them. And now any of these assets that we're building with them, we both benefit from it downstream. And then for other systems, it becomes a lot less expensive because a lot of these assets are pre-built. So we're able to lower the cost even more for other systems. So that's a very unique opportunity for us to really partner with them in that way. And we're like, it's been amazing.
And I love it. And when I do have other health executives that have said, tell me the value of your platform. There's cost savings because it is workforce augmentation, right? There's potential revenue, especially with audits and control. There's compliance, there's quality.
Right.
But now I can say revenue as well. What a lot of people don't realize with our EULA, the bots are ours, right? And we have a full extensible system, so we are very open. But the workflows you build are yours. They're your intellectual property. Intellectual property becomes an asset. And to your point, if you can sell it to another health system and say, I've proven this use case, you're going to get a 2x return in the next 6 months. You might have to customize it. That customization will take you 2 days. I can come in and do it for you, but I can get you there 45% faster. That's 45% faster return than Mercy saw in their first wave, which was like 8 weeks. So getting 4 weeks, what they got in 8 weeks, is pretty amazing. I think the EOB one took 12 and a half, 13 weeks. So to get that in 6 weeks, who would say no to that?
Exactly.
And they would pay for it, right? And I think that's where the model is, because you are the managed service for that, and Mercy has other customers that use Epic instances, and a lot of their use cases are Epic.
Right.
So,
Yeah.
it's a very interesting use case.
Yeah, and I think the other part of this is like once you build it, we are able to leverage that for anyone else, right? So your point of like speed to market, the cost is lower. I mean, it's like very hard to say no to that, and you have a proven ROI as well,
Yep.
right? So absolutely, and that's been really beneficial. And our Flint product suite is leveraging some of those assets as well.
Yep.
So
Yeah, I love the product. So I think we're right about time, Amit. Really appreciate you joining me today at HIMSS. I wish you all the luck, and as always excited to see more opportunities with Amitech, and absolutely our joint customer Mercy, who's also a firm partner and doing a lot of this work. And we'll definitely see you next time. Thank you for joining.
Oh, sure. This was my pleasure, and thanks, Jason, for having me here. Yeah, look forward to next episode of this.
Yeah, my pleasure.